Okay, we will continue with the diarrhea. So in the last class we have seen the difference between the small intestinal diarrhea and large intestinal diarrhea. In the small intestinal diarrhea we again seen what are the nature of characteristic features of acute diarrheas and chronic diarrheas, and we have also seen in the large intestine what actually happens. And we have seen the major function of the small intestine as absorption of the nutrients, and when it is not happening, definitely there will be formation of the large amount of the stool. Whereas the main function of the large intestine is restricted to absorption of the water, to some extent absorption of the vitamin B12 and the short chain fatty acids. So large intestinal diarrhea will most of the time will have small amount of the stool, and there will be tenesmus and there will be pain or dysentery. Okay, dysentery is not at all seen in case of small intestinal diarrheas. Dysentery is always large intestinal diarrhea. Okay, whenever blood mixed stool is there, definitely it is a large intestine. So this much of anatomy we have seen in the last class. Today we will see why does there is diarrhea. Okay, so common people call, whenever there is a diarrhea, common people say this is because of indigestion. Okay, so यूजुअली जो लोग यही बोलते हैं कि अजीर्ण हुआ है या पचन नहीं हुआ है. सो दिस इज मोस्ट कॉमनली यूज्ड वर्ड व्हेनेवर दिस डायरिया. ओके, so now the question comes, if you indigestion, then what do you mean by digestion? So digestion is the process where enzymes will be acting and there will be breaking of bigger molecules of the food into smaller molecules like amino acids, fatty acids, glycerol, glucose, etc. And this is called as a digestion. That means avasthapaka, what is explained in the avasthapaka in our science. So different avasthapakas are taking place, and that's called as digestion. And when this is not happening, the same is called as indigestion. Indigestion. The word why it is called as indigestion, actually it may be undigestion. Okay, but usually it is called as indigestion. Anyway, we will not go with the words. Okay. Now, if this particular process of avasthapaka is not taking place properly, if it is poorly digested, what is the main problem? Suppose the digestion is not taking place properly, the molecules are not broken down into small materials or small compounds or molecules, enzymes are not working. Now what actually happens? Actually food is not get converted into its smallest form or minutest form. So when food is not broken down into the minutest form or smallest form possible, the main problem occurs with the absorption. Okay, for the absorption it has to be broken down into smallest form or minutest form. Protein has to be broken down into amino acids. Fat has to be broken down into fatty acid and glycerol. Carbohydrates must be broken down into glucose. Then only it is absorbed through the villi. Okay. So therefore, to have this process, to break down them into the smaller particles so that can be absorbed through the villi, the enzymes are required to break down them. So enzymes start working from the saliva itself. We know that salivary amylase. Okay, and similarly there are the enzymes coming from the stomach secretions, enzymes coming from the intestinal secretion, enterokinase, pancreatic secretions, and bile juice. Okay, so these are all the different things. Now basically, although we call it as indigestion, medically it should be called as maldigestion. Medically it should be called as maldigestion or undigestion. Okay, but usually we will call it as indigestion. Anyway, we will not go with the words. Okay. Now different enzymes, when they are not working, so there will be different types of the problem. Suppose the stomach secretions like the HCl and as well as pepsin, renin, etc. If they are not secreted, actually the problems start for the protein molecules. Okay, so protein molecules are not actually broken down into proteins and peptones, and the formation of the amino acid as the end product, minutest part, is not possible. Similarly, enterokinase, which are produced from the intestinal mucosa, superficial layer of the mucosa of the intestines, so they play a very important role in breaking down of the carbohydrates. So different carbohydrate, oligosaccharides, monosaccharides or trisaccharides, so they all get converted into glucose by means of action of lactase, sucrase, maltase, etc. And fat is get digested by the bile juice. We know that the bile juice, it contains the bile salts, sodium tauroglycerate and sodium glycotaurate sulfate. So these two are very important for breaking down of the bile salt, breaking down of the fat molecule. Of course, fat is also get digested by the serum amylase, which is produced from the pancreatic juice. Okay, not serum amylase, pancreatic lipase. Pancreatic lipase, which is produced from the pancreas, also play a vital role in case of a fat digestion. That's the reason in case of cystic fibrosis we will have fat maldigestion. Okay, so these are some of the basic things about this diarrhea. Now let us go further. Why does there is diarrhea? We will continue now. Diarrhea may be due to failure to absorb or due to lack of enzymes. Now we go to little detail. Okay, so जब diarrhea हो सकता है, so it may be because of two important factors. Number one is there is failure to absorb. As I told, the particles are not get converted into minutest form, therefore villi is not able to absorb it. That's the one issue. Another one is a lack of enzymes. When there is lack of enzymes also, there may be diarrhea. I will explain that. Now, sometimes there will be lack of enzymes. Now, diarrhea may be due to failure to absorb. That I will explain that how it is get converted into smallest molecule. That is over. So, lack of enzymes and diarrhea, that is also important. These lack of enzymes may be sometime congenital, sometimes they may be secondary, sometimes they may be because of malnutrition, and sometimes it may be because of allergy and hypersensitivity, and sometimes it may be because of the endocrinal causes. So we shall see in detail now. Congenital, there are sometimes some of the enzymes are not congenitally present. That means congenitally they are absent. Okay, for example, one of the best example is congenital lactose intolerance, which is also called as primary lactose intolerance. Or we have got different types of inborn errors of metabolism where fructose deficiency, okay, sucrase deficiency, galactose deficiency. So like the different types of inborn errors of carbohydrate metabolism are the best example where the enzyme which has to digest that particular part of the sugar is absent, and that leads to the diarrhea, as we have seen in case of a lactose intolerance, fructose deficiency, sucrose intolerance, etc., galactose deficiency, etc., galactase deficiency. Okay, as in case of galactosemia, you can say galactosemia, fructosemia, galactosemia, okay, or lactose intolerance. So we cannot do anything in this condition because it is a congenital problem where there is hereditary, that particular enzyme is not produced because of some of the genetic defect. So only way out is you have to avoid such type of food particles. That's the only way out. Another way where the lack of enzymes may lead to diarrhea is, so in the first example, congenital, suppose a person is not having lactase enzyme genetically, then if he take the lactose rich food, the lactose will not be get digested, and the lactose will be stored in the intestine. It pass through the intestine into the large intestine, come in contact with the bacteria, and what happens later we know that lactose itself is a osmotic laxative, and there will be diarrhea. Similarly, when you talk about secondary causes, secondary causes where there is a lack of enzyme, the causes are secondary. Many times after chronic disorders this may happen. Okay, so in malabsorption it can occur, chronic infections it can occur, like Crohn's disease, ulcerative colitis, celiac disease, etc. See, if you take the example of celiac disease, it's a chronic problem. Secondary to celiac disease, there may be absence of the enzymes. Now, celiac disease causes damage to the intestinal mucosa, and once the intestinal mucosa get damaged, the superficial layer of the mucosa, which is producing so many enzymes like lactase, sucrase, fructase, etc., so it may not be produced, and as a result, so there will be absence of digestion related to this particular enzyme. Like if the lactase is absent, lactose will not be digested. If the sucrase is not produced, then sucrose will not be digested. So this is actually diarrhea because of secondary causes. Okay, it may occur because of any gastroenteritis like conditions also at times, or some chronic conditions like Crohn's disease, ulcerative colitis, celiac disease, or some other inflammatory bowel disorders, etc. Secondary causes. Sometimes enzymes may not be there because of the transient causes, so which is not mentioned here. Transient causes. For example, this happens in newborn. We will call it as temporary lactose intolerance. Okay, newborn intestinal gut is not much matured, so it is not produced expected amount of lactase enzyme, but we are giving the feed to the baby. We know that milk and as well as breast milk both, so they are rich in lactose, so there will be overloading of the lactose, but to digest that particular lactose, sufficient amount of the lactase is not formed because of immaturity of the gut mucosa. So there may be diarrhea during that time, but it is transient. As the gut maturity takes place, normally a good amount of lactase will be formed and lactose will be digested. So that's called as transient causes. There are many secondary causes, as I told, ulcerative colitis, Crohn's disease, etc. may also lead to diarrhea. For example, even in case of PM also, protein energy malnutrition, because we know that protein energy malnutrition is there's a protein problem, isn't it? We know that all the enzymes are proteins, all the hormones are proteins, isn't it? So when there is a protein deficiency because of PM, there is no protein to form the enzymes also, so there may be enzyme deficiency leading to secondary causes of diarrhea. Sometimes diarrhea may be also there because of malnutrition, as I told just now, in case of PM or in case of celiac disease, etc. See, in celiac disease, actually what happens? The mucosal atrophy will be there. Crohn's disease, again the mucosa is damaged. Ulcerative colitis, again the mucosa is damaged. Because of the damage to that particular mucosa, enzymes are not produced, and that may lead to the problem. Sometimes diarrhea may be also there because of some of the allergy and as well as hypersensitivity reactions. Okay, food intolerance, allergies, hypersensitivity reactions may also cause the diarrhea. Okay, because suppose any allergic food is taken inside, and that allergy will go into stimulate the mucosa of the intestine, and peristaltic movement will be increased, and because of the rapid peristaltic movement the things are passed off, and there will be disturbance of whole matter because of allergy. So there is irritation, and there is sometime antigen antibody reactions like can also take place. Sometimes because of endocrinal problem also there is diarrhea. One of the best examples is thyrotoxicosis. Okay, thyrotoxicosis, where the thyroxine production is more, and that is acting on the intestinal mucosa and increasing the peristaltic movement. Therefore, in thyrotoxicosis we will have diarrhea, and in case of hypothyroidism we will have constipation. Okay. Now we come to another important part, which is called as hunger diarrhea. There is a condition called as hunger diarrhea. We need to understand this hunger diarrhea very well, because as we deal with the small kids oftenly. Okay, so usually, what do you mean by hunger diarrhea? Usually this occurs when child is not eating properly, when he is hungry. That means mother is not taking the feed, not giving the feed to the child when actually child is hungry. Okay, or the feed time is very irregular. Now because of this there will be hunger diarrhea. What do you mean that? If hungry and not eating, then there should be constipation, isn't it? Why there is diarrhea? The question comes. Child is hungry and you are not giving it properly, food in time, then child should have constipation, but there should not be any diarrhea. But there is diarrhea. Okay, the reason is, you just go back to the physiology. All the secretions, including the bile duct secretion or bile juice, all the secretions including the bile juice are actually secreted in a periodic rhythmic fashion in our body. Okay, actually the secretion, hormonal secretion and enzymatic secretion, so they follow a rhythm. Therefore Ayurveda says te vyapino virinabhyo ado madhyo adi antagaha. Okay, the secretions of Vata, Pitta, Kapha will maintain a rhythm. According to that rhythm, they will going to produce their actions, isn't it? So te vyapino pirannabhyo ado madhyadi during the time of the digestion, in the evening time, in the morning time, in the afternoon time. So the doshas will maintain their rhythm. Doshas will always maintain rhythm. So what I mean to say is all the secretions, hormonal and enzymic secretions, so they always follow a rhythm. Okay, so that's what they are telling. All the secretions, including the bile, will be secreted in a periodic rhythmic fashion. Okay, that rhythm has to be maintained. Whether the food is present or not present, but the secretions will be there in a very periodic manner. Suppose 1 o'clock afternoon you are taking the food usually, but today you are not taking the food, but still at 1 o'clock there will be secretion of the enzymes. Food is present or food is absent, that's no matter, but body always maintain a rhythm. Okay, so as we told before food intake, there will be increase in the vata. After during the digestion of the food, there is increase in the pitta, and after the digestion, there is increase in the kapha. Similarly, for the day, night, etc., as told in Ayurveda. Similarly, this particular rhythm is maintained. Okay, so and also the peristaltic movements. Now, even the peristaltic movement is also related to the same. Okay, peristaltic movements also increase periodically. Now, what actually happens in case of hunger diarrhea is when the bile juice is secreted into the intestine. Bile juice is also a secretion which gets secreted into the intestine through the bile duct periodically. Okay, and when the bile juice is coming to the intestine, in the meantime, if there is no food in the intestine, okay, either feeding is delayed or some other problem, there is no food in the intestine, but bile juice is secreted. Okay, as it occurs in case of hunger. Now, if I am hungry, nobody is giving to eat something to eat me, and my bile juice will going to secrete in its own time. But unfortunately, there is no food in my intestine or stomach that time, and the food is not reaching the second part of the duodenum. So there is no function for that bile. So what that bile will do, that bile will now just propel forward. Okay, and if there is no food, as it occurs in hunger, the bile is not at all used. Now this bile is greenish in color, we know that, and it pass on to the intestine and pass into the large intestine, and then it is passed as stool, and patient will have the greenish stool. Now the child passes the greenish stool. Okay, so this is called as bile stained stool. Mother appreciates this condition as a diarrhea, definitely, because the loose stools are going, because there is no food, only bile is going. Okay, so this is usually occurs when either the baby is starving or if the mother is not giving the feed in a regular fashion, in a fixed way. Okay, so no food, that means irregular way of feeding. Sometimes she is feeding on every 3 hours, sometimes she is feeding in every 1 hour, or sometimes she is not at all feeding the daytime, only feeding night. So this type of irregularities in the feeding, and when mother is failed to understand that my child is hungry by observing the hunger cues, so this problem can occur. So baby may pass simply a greenish stool, okay, and mother appreciates it as greenish stool or greenish diarrhea, and actually this condition is nothing but hunger diarrhea. Okay, so why? Because when the bile is reached the second part of the intestine, there is no food. So where this bile will going to act? Nobody is there to act, isn't it? There is no food. So this bile has to propel down now, and slowly it pass on to the large intestine, and there is passage of the stool. And this is called as hunger diarrhea. Now we have got some other types of the diarrheas also. Golden yellow color. Most of the time baby passes golden yellow color stool. If you see the breastfeeding babies or even the cow's milk fed babies, so usually they passes golden yellow color stool. Okay, so gradually thereafter it becomes brownish as the age passes. So do you know why this golden yellow color is there? That is because of the presence of a pigment in the breast milk, which is called as lactochrome. Lactose is rich in breast milk, and lactochrome is a pigment present which gives a yellow color. Okay, so by looking at the stool itself, you can say whether mother is feeding the breast milk or not. If the breast milk is fed, then it will be golden yellow color. Okay, now how to differentiate cow's milk and breast milk fed stool? In breast milk fed babies, the stool is dark golden yellow color, whereas in cow's milk fed babies, it is not much dark. Both are yellow, golden yellow only, but it is very dark in case of breast milk and little less dark in case of cow's milk. This is one important condition. Next, white stools are associated with the fat and malabsorption. Whenever the baby is passing white stool, many times mother complains, mother passes the white stool. That suggests that white color suggests that malabsorption of the fats. So fat malabsorption is there. Or the white stool may be also there because of obstructive jaundice, as we say in Kosta Shakashrita Kamalas and Shakashrita Kamala, also Tilapistaniba, what we say. And the white color, so fat as if passes, okay, because of obstructive jaundice, bile is not reaching the stomach, bile is not reaching the intestine, so nobody is there to digest the fat, so fat goes as if, and patient passes tetrorrhea or the white color stool or fatty diarrheas. So white stools may be associated with the fat malabsorption, any kind of, maybe in cystic fibrosis or maybe A beta lipoproteinemia, etc. conditions, and even in case of obstructive jaundice. Now sometimes diarrhea may be there because of worm infestation. Even the worm infestation may also cause the diarrhea, and usually in case of worm infestation we will have grayish color white stool, a large amount will be there and very foul smelling. So usually see, worms, they cannot stay in the large intestine because in the large intestine there is no nutrients at all. So what they will do, so they will be present in only those areas where they get the maximum nutrients. All the nutrients are present in the small intestine, so their most favorite place is always small intestine. Okay, so if a worm infestation is causing the diarrhea, definitely it is a large volume stool. Okay, large volume stool, and very foul smelling also, because sometime because of the death of the worm, sometime, or sometimes because of the necrosis or whatever, the waste products, etc. And usually, so they stay in the intestine. Pinworms, although they are usually seen in the anal area, threadworm or pinworms, what is a pinworms, their actually habitat is small intestine only. They just go through the large intestine in the evening hours and enter into the perianal area and lay the eggs there. Otherwise, they largely get their nutrition from the small intestine only. Okay, of course, that particular course of the pinworm infestation, which goes along the Taenia coli of the intestine and into the large intestine, enter into the perineal, that's called as auto infection or retrograde infection. It is also called as retrograde infection, that we will see later. But otherwise, the most favorite area of the worms is nothing but the small intestine, because they will get a lot of nutrients there. One of the most common problem which is seen in a newborn is, rather in children, is giardiasis. Giardiasis is most commonly, it may be present as acute or it may be present as a chronic. Again, in the Crimirogas we will see this condition. Now occasionally, sometimes baby may be fed with too much of milk diet. So this is also possible. Sometimes we are giving a lot of milk to the baby. That time also baby may pass white stool. Okay, most of the time mother says, शायद दूध ज़्यादा हो गया है इसलिए white color stool आ रहा है. It may be because of the fat, or sometime when you excessively feed the baby with the milk, this may happens actually. Okay, and a black color stool, suppose the child is passing a black color stool, that's called as melena. Okay, it may be because of any causes of internal hemorrhage or concealed hemorrhages or hidden hemorrhages. Okay, so fresh blood, suppose the child is passing the fresh blood, the origin is always perianal origin. It's very recent because it is fresh, it is not mixed with the stool. So definitely it is a fresh blood that is usually seen in case of hemorrhoids, fissures, etc. But if the blood is mixed with the stool, that suggests that it is far away from the anal area. It may be in the large intestine, it may be in the small intestine. Okay. Now, sometimes if you get the greasy stool, a large amount with the foul smelling, that means greasy stool means very, very sticky stools, pichila, sticky stool, and large volume is also there, and is also foul smelling. See, whenever you get foul smelling, one thing is made clear that so there will be fat malabsorption, because fat, when it is not absorbed properly, undergo rancidification and all those things, and there will be bad smell. You might have been experienced it. Okay, so presence of the bad smell, excess over blood, bad smell, offensive smell, usually suggests that fat is not properly get absorbed. Now, when white stools are there with the foul smelling, very much foul smelling, so you have to think about some of the fat problems. Maybe because of pancreatic insufficiency, or as in case of cystic fibrosis, or maybe it's because of some of the liver problems where bile juice is not secreted into the second part of the intestine. Now, how to know the problems of carbohydrate absorption? Now, in the last class also I told. See, without doing anything, just asking some of the question to the mother and also by observing the stool, you can actually identify which particular malabsorption is going on in the body. Whether there is a carbohydrate problem, or whether there is the protein problems, or whether there is a fat malabsorption is taking place. So you can identify it. It's all about the clinical sense. Suppose if the mother says that I have given the carrots, it comes acid out. Sometimes mother may say, मैं उसको कैरेट दे रहा था और वो जो है अपने आप वैसा का वैसे ही बाहर आ गया. Okay, so this is also plausible in the clinical scenario. Okay, now come to this point, how to know the problems of carbohydrate absorption. Very simple thing. Suppose if the carbohydrates are not absorbed, then there will be large stools, definitely, because we know that carbohydrates are nothing but glucose. Glucose is nothing but the osmotic laxatives, and we also know that the glucose is absorbed from the small intestine. So there will be large stool. It's watery, and also there is reducing substances in the stool, and also there is perineal excoriation. This we have seen in the last class also. Very simple. Look at the perineal excoriation. Look at the quantity of the stool. Find whether it is a loose stool, and find it as a large stool. Okay, and reducing substances. Of course, this is done only by investigations. As a reflect of this reducing substances, there will be anal excoriation. Reducing substances are nothing but acidic substances. So when that touches the smooth skin of the anal area, there will be anal excoriation. So if these findings are there, definitely the problem is always with the carbohydrate metabolism or digestion. Okay, so can you identify which sugar is not absorbed? No, by these symptoms we identified, yes, sugar is problem with the carbohydrate. Now can you identify by which sugar actually which sugar is not absorbed? That also you can do. Okay, पहले तो हमने बोल दिया सभी ग्लूकोज है या फ्रक्टोज है, ये सब है, बट हम ये भी पता कर सकते हैं कि इसमें से कौन सा है, लैक्टोज नहीं गया क्या, सुक्रोज नहीं गया क्या, इतना भी हम क्लिनिकली उसको अप्लाई कर सकते हैं. ओके, of course, कौन सा पर्टिकुलर शुगर, बिकॉज इफ यू टेक लैक्टोज, सुक्रेज, फ्रक्टोज एक्सेट्रा, अल्टीमेटली दे आर गेट कन्वर्टेड इनटू ग्लूकोज इटसेल्फ. ओके, सो देयरफॉर आइडेंटिफिकेशन ऑफ द इंडिविजुअल शुगर इज क्वाइट डिफिकल्ट. ठीक है, कौन से है, क्योंकि अल्टीमेटली तो सब ग्लूकोज ही बनने वाला है. बट लैक्टोज वी कैन आइडेंटिफाई टू सम एक्सटेंट. ओके, वेदर चाइल्ड इज एक्चुअली हैविंग प्रॉब्लम विद द लैक्टोज और अदर शुगर्स, दिस you can identify. How? Lactose enzyme is actually most superficially staying enzyme. That means जो intestine का जो mucosa है, वो mucosa का most superficial area से lactase enzyme का secretion होता है. उसका नीचे से sucrase, maltase ऐसा secretion होता है. और जो सबसे ऊपर वाला जो layer है mucous membrane में, so that always produces lactase. So therefore, in any type of damage, it may be inflammatory, non-inflammatory, infectious, या allergic. So usually which is affected, the most superficial area of the mucous membrane is get affected. So superficial area will always produce what? Lactase. Okay, so in almost all any causes of diarrhea, there will be always lactase intolerance. That's the reason. Okay, so lactase enzyme is most superficially staying enzyme in the intestinal mucosa, and when mucous membrane is shed up due to any causes, okay, the lactase producing cells will be also gone, washed away, and lactase remains unabsorbed because lactase is not formed, therefore lactose is remain unabsorbed. So in any diarrhea there will be lactose intolerance. There will be lactose intolerance. Therefore, if you see some of the doctors, they will stop the milk whenever there is diarrhea because milk is rich in lactase, and that lactase is digested by the lactose is digested by the lactase enzyme, which is most superficially staying in the mucosa, which is damaged, and definitely this lactose will not be get absorbed. Therefore, most of the doctors, they stop the milk in any cause of diarrhea for 2 or 3 days. Okay, so lactose intolerance will be there in almost all diarrheas. So don't go stool for sugar in diarrhea, it will be always present. ठीक है, इसलिए आप डायरिया के केस में स्टूल एग्जामिनेशन करेंगे तो शुगर हमेशा पड़ेगा, शुगर आपको हमेशा मिलेगा बिकॉज लैक्टोज तो हमेशा मिलेगा ही. ओके, so this is one important case. Therefore, just remember, whatever may be the case of diarrhea, if there is a damage to the intestinal mucosa, lactose intolerance will be there to some extent always. So preferably you can stop the milk for 1 or 2 days. Okay, so now suppose if protein is going down, अगर प्रोटीन जा रहा है, if the protein is going down, प्रोटीन लॉस हो रहा है, आपको प्रोटीन डाइजेशन नहीं हो रहा है, तो देन प्रोटीन लॉस विल ऑलवेज लीड टू बॉडी वेस्टिंग, बॉडी वेट कम होगा because muscle mass कम होगा because protein is nothing but the building blocks of the body. Okay, and if the protein is not there in the body deficiency, then protein deficiency leads to edema. So as in case of kwashiorkor, if there is a presence of edema, body mass is decreasing. Okay, if there is caloric insufficiency, then it suggests that कुछ protein के साथ problem है. Suppose mother complains that child is having diarrhea since last 1 or 2 months and now his weight is coming down and is also developing edema. Clearly it suggests that there is some problem related to protein deficiency. Now if fat malabsorption is taking place, one is body weight will go down, subcutaneous fat वगैरह कम होगा. दूसरा, fat soluble vitamins. Okay, see there are A, D, E, K, these are the fat soluble vitamins. If the fat is not properly absorbed, metabolized or whatever utilized, then it also affects the fat soluble vitamins, because fat soluble vitamins तभी absorb होगा जब fat का digestion and metabolism अच्छे से होगा. फैट ही नहीं रुक रहा है, फैट का ही डाइजेशन नहीं हो रहा है, तो फैट सॉल्युबल विटामिन्स कैसे बचेगा? नहीं बचेगा. सो देयरफॉर इन फैट सॉल्युबल, इफ देयर इज अ फैट malabsorption in the stool, you can identify the whitish stool or foul smelling stool or fatty stool. Along with that, you also find the symptoms of fat soluble vitamin deficiency, like vitamin A deficiency, vitamin D, vitamin E and vitamin K deficiency symptoms can be also seen. So this is how you have to identify the causes without going much investigation or without doing much investigation. So next we will go for common causes of diarrhea. What are the most common causes of diarrhea which is encountered in day-to-day practice?